This is Talk Business and Politics with Roby Brock.
And welcome to the program. I'm Roby Brock. We're glad to have you with us. The healthcare sector has had a tumultuous 6 months. Our hospitals and medical communities have been on the front lines facing the COVID-19 pandemic, and they've seen their business models disrupted by the economic shifts as a result of business closures, consumer behavior, and governmental action. But some things have become more stable and better known now. I sat down with Troy Wells, CEO of Baptist Health System, the state's largest hospital and healthcare group, for his perspective on where we are and where we're going. Let's go back to mid-March and when the sky fell from the ceiling there. What were you thinking when you kind of realized, we knew the pandemic was coming to Arkansas at some point in time, but when it really truly hit, what was your first reaction?
Well, the first reaction was just, how do we need to respond? And I use the analogy with people frequently that this has been, since March, a series of really nasty math problems for the healthcare system. And so if you start, the first math problem was the clinical issue. When is it going to hit? Do we have enough protective equipment to take care of our employees and our patients? How bad is it going to be in Arkansas? What are the numbers going to be? And how are we going to solve for all those things? And then to solve that one, created a second one. So the whole notion of shutting down elective surgeries, for example, part of that was not just for patient safety, although that was a consideration, but it was personal protective equipment, masks and gowns, and the things you use in those cases. And then trying to understand, can we use those staff to redeploy to care for this surge that we don't know when's going to occur or how bad it's going to be? And so that second problem was the financial problem. So if we do all this to solve number one, what's the financial implication to revenue and our cost structure, and how are we going to survive this if we shut down all these services? And on top of that, a lot of patients just said, hey, I'm nervous, I'm scared, I'm not going to come in for care while this is going on. And some of that's actually continued. So then you move to the third math problem, which is kind of where we are today, dealing with the pandemic on an ongoing basis, not knowing when it's going to end, resuming all those other types of care that we provide, the surgeries and all the other patients that are now coming back, who, by the way, are really a lot sicker because they delayed a lot of care.
Right.
Then you've got the financial fallout. So everybody's trying to recover financially and take care of patients and deal with critical care shortages and staffing shortages that we have today that we didn't have 3 or 4 months ago.
To quote the movie line, I was told there'd be no math. Okay, no, I'm just kidding.
We don't have to go through the formula. It is nasty.
So give me some idea of what the financial picture is. I mean, I'm not asking you to share proprietary information, but I mean, kind of where do you sit financially as a system today?
We're actually in really good shape considering the circumstances. One thing that we did, this was back in March, and we were in that first to second math problem I just described. We took quick action. We had a lot of uncertainty, and when in the face of that, we said, we need to be aggressive, we need to be prepared for a really difficult situation going forward. So we took some pretty aggressive steps, and it was pretty well written about and known that we furloughed a lot of our employees early on. We took some other steps to mitigate financial implications of the virus, the impact on the health system, but we did it really early, like back in early April. I mean, I was proud of our team, we acted quickly. And because we did that, by the time May and June rolled around and volume started to come back, our patient services increased, we were in really good shape from a cost structure perspective. And so, we closed our second quarter consolidated numbers in a positive position because of the action we took way back in April.
Can a lot of other hospital administrators around the state say that?
Some may be able to. I think a lot of folks were a little bit behind where we were just from the conversations we had. I think part of the challenge that we had and everybody had is the uncertainty. Is it really going to be bad? Is it really going to hit Arkansas? Maybe we don't have to act this quickly. Maybe we can wait and see. And I think what we've learned is, in that type of situation, wait and see may not be a really good strategy.
Right.
And I think there's lessons from that we can learn going forward as we deal with the uncertainty we have today.
Yeah. So kind of give me, you furloughed a lot of employees. You've brought some back?
I'm real proud to say by the end of July we had everybody back. We brought all our workforce back. We restored some of the retirement benefits we had to stop making at the time back in April. We've restored that now as of the end of this month. And we're doing great. Now our volumes, to talk about where the business is, we did this with a little bit of risk. Volumes are not at 100% of pre-COVID-19. Right. We're running about 5% per week below where we used to be, and that looks like, for the time being, could be the new normal for us. So we've got to figure out.
In the grand scheme of things, though, 5% off based on the trauma that the system has experienced, that's not bad.
Not bad at all. And
Yeah.
that was the impetus for saying, you know what, we need to bring our people back, get them back to work, make sure we can provide the services the way we need to. Now, the one area that across the nation and in the state that's still down pretty dramatically is the emergency room. So for our whole system, we're down about 19% in the ED. And it varies across our 11 hospitals. Little Rock's only down 6%, Fort Smith's down 25%, North Little Rock's down 20%, but on average it's 19% across the system. That's huge. And this is where, I was on a call last night with some medical staff leaders at some of our hospitals, and they're describing the patients that they're seeing now are really, really sick. And these are physicians saying, this is a guy that didn't come in for the past 3 months to get taken care of, and now he's really, really ill. So that's the implication of a lot of folks not coming when they need to. And when I looked at our specific data for Baptist Health, the biggest change in that ED volume is in cardiovascular disease. So the message out there is, if you got chest pain, go to the ED. Don't think it's going to be okay. Don't wait. But that's where we're seeing the big difference.
Certainly one of the biggest health risks for Arkansans, as we see, is heart disease and that heart risk there. So what do you there is this uncertainty about where things are going to go. There's a lot of projections out there for the fall that once school starts, it's going to get worse again. We're going to see this second wave. How do you plan for that, and how bad do you think it could actually be?
Well, I hope it doesn't get worse than it is today. I think the state as a whole is managing this pretty well from the healthcare provider perspective, from the state government perspective. We're doing a good job. It's manageable. If we had double what we're dealing with today, that could be problematic from a critical care capacity standpoint more than anything. So we're obviously concerned about it. We'll be curious to see what happens with cases when school starts, and if it's a younger population, does that really impact hospitals much? We hope that it won't. Don't think that it will. So there's the active cases in the community versus the hospital caseload, and they're not always the same. I think that for health systems in general, to be successful going forward and to survive all this, you got to do a couple of things. I think you have to minimize a lot of operating risk that hospitals today have, especially here in Arkansas. You've got margins that are on a good year 2 to 4%. I mean, it's not really that stable. So there's operating risk there we already have.
Give me an example of something in that vein.
Of operating risk?
Yeah.
So we've got low margins already. You've got now this downturn in volume. The 5% for us, maybe 10% or 15% for someone else. You've had hospitals that have taken on some short-term debt for liquidity purposes. Now you got to decide what to do with that. Do you convert it to long-term debt and secure your cash position? Or do you pay that money back and then be exposed if there is another ramp up in 3 months from now? So I think you got to figure out how to mitigate some of that operating risk. And then the other thing I think we have to do is be able to multitask. You've got to be able to recover your financial situation. You've got to be able to adapt to now taking care of not just COVID patients, but all these other patients that need care, some of which are sicker than they would have been normally, like we talked about. And then continue to plan for the future. So just because we're dealing with COVID today doesn't mean that we can stop thinking about the direction of our health system and our hospitals for the future, what our community needs are, what our patient needs are going to be, the investments we need to make today. Even though there's a lot of uncertainty, you can't just freeze and stop. And so you got to be able to multitask.
Is the vaccine, is that going to be the only way you feel like we get over the hump on this?
Well, from all the scientists, that seems to be the solution. I thought, the optimism in me back in March was by July this virus is going to die out. That's what happens.
Its course.
People don't get colds in the summertime as much, and it's just going to change. Well, it didn't happen, and so we continue to see these little surges all over the country, and even in Arkansas, in different parts of the state, it's different. So, when I listen to the medical experts around the country, the vaccine seems to be the solution to this. Now, the challenge or the worry I have is that it's not one vaccine and you're done. It's, one vaccine and 3 months later, your antibodies have worn off, you need another one. So I don't know what that's going to look like, but I know a lot of smart people are trying to figure it out.